Pancreatic cancer often hides in plain sight, showing symptoms so subtle that they're easy to miss. Yet, recognizing these early warning signs could make all the difference. Pancreatic cancer is among the deadliest cancers out there, with only about a 10% chance of survival over 5 years. Most people don't realize that some of the earliest signs might appear as everyday issues, things we wouldn't think twice about. But knowing these signs now could mean catching it in time. In this video, we're breaking down the 10 warning signs of pancreatic cancer you should never ignore. These could save your life or the life of someone you love. And if you're interested in learning more health insights like this, subscribe to stay informed and prepared. Sign number 1, dark urine. One of the earliest clues your body might give you is dark-colored urine. Your pancreas works closely with the liver and gallbladder, moving digestive enzymes and bile through a series of ducts. When pancreatic cancer interferes with this system, it can lead to a buildup of bilirubin in your bloodstream. Bilirubin is a yellow substance produced when red blood cells break down, and the liver usually processes it and removes it from the body through digestion. But if a tumor blocks the bile ducts, bilirubin builds up and can't be properly filtered out. This causes urine to darken, often turning a tea-like color. Medically, this condition is called coluria. While dehydration or certain medications can also darken urine, a consistent change to a darker shade, especially with other symptoms, is a serious red flag. If you notice this change, consult a healthcare provider right away. Sign number 2, oily stool that floats. Another symptom to keep an eye on is oily or floating stool. The pancreas produces enzymes that help break down fats, proteins, and carbohydrates in our food. When cancer impacts the pancreas, enzyme production drops, leading to a condition called malabsorption, meaning that nutrients, particularly fats, aren't being absorbed as they should. This can make stool look greasy or oily, causing it to float on the surface of the toilet water. This happens because undigested fats are lighter than water, making the stool rise. Known medically as steatorrhea, this stool may also have a strong odor. If you notice this change for several days, it's time to speak to your healthcare provider. Sign number 3, jaundice. Jaundice is a more visible and often concerning symptom of pancreatic cancer. It happens when bilirubin builds up in the blood, causing the skin and the whites of the eyes to turn yellowish. Normally, the liver filters out bilirubin, but if a pancreatic tumor blocks the bile ducts, bilirubin can't be excreted. This buildup, called hyperbilirubinemia, turns the skin and eyes yellow. Jaundice is often one of the first visible signs of pancreatic cancer and should never be ignored, as it could indicate a blockage in the liver or pancreas. If you or someone close to you notices this yellowing, it's crucial to seek medical advice. Sign number 4, itchy skin. Persistent itching, especially on the hands, feet, or other areas, could also be related to pancreatic cancer. When bilirubin accumulates due to a blocked bile duct, it can cause pruritus, where the skin feels itchy and irritated. It may start as mild itching but can worsen over time, sometimes becoming intense enough to interfere with daily life and even sleep. Over-the-counter treatments often don't help, so if this unexplained itching persists, it's worth consulting a doctor to rule out potential underlying issues. Sign number 5, blood clots. Blood clots can be a serious warning sign of pancreatic cancer. Cancer cells release substances that increase the likelihood of blood clots, which can be life-threatening if they form in places like the legs or lungs. Blood clots in the legs, known as deep vein thrombosis (DVT), cause pain, swelling, and redness, while clots in the lungs, called pulmonary embolisms (PE), can lead to chest pain, shortness of breath, or coughing up blood. If you experience any of these symptoms, it's essential to get medical attention immediately. While not everyone with pancreatic cancer will have blood clots, and not every blood clot indicates cancer, these symptoms should always be evaluated by a doctor. Sign number 6, swollen gallbladder. A swollen gallbladder can also signal pancreatic cancer. This small organ, located near the pancreas, stores bile from the liver. When a tumor blocks the bile ducts, bile builds up in the gallbladder, causing it to swell and sometimes become tender. This condition, known as cholecystitis, often causes pain in the upper right part of the abdomen, which may radiate to the back or right shoulder. Nausea, vomiting, and fever can also be symptoms of a swollen gallbladder. If you experience these symptoms, seek medical attention, as imaging tests like an ultrasound or CT scan can help identify the cause. Sign number 7, Sudden, unintentional weight loss. A sudden and unexplained drop in weight is another common sign of pancreatic cancer. Unlike intentional weight loss from diet or exercise, this type of weight loss happens without any effort and can be a sign that the body isn't absorbing nutrients properly. When pancreatic cancer affects the pancreas, it can reduce the production of enzymes needed for digestion. This makes it harder for the body to break down food and absorb nutrients, leading to malnutrition and weight loss. Additionally, cancer cells need a lot of energy to grow and spread, which causes the body to burn more calories than normal. As a result, people with pancreatic cancer often lose weight rapidly, even if they are eating the same amount of food. A weight loss of more than 5% of your body weight over a few months without trying can be a red flag. For instance, if someone who weighs 150 pounds loses more than 7.5 pounds without changing their diet or activity levels, it's a sign that something may be wrong. While stress, thyroid problems, and other health issues can also cause unintentional weight loss, it's important to consult a healthcare provider if this happens, especially if other symptoms like pain, nausea, or fatigue are also present. Early medical attention can help identify the cause and ensure you receive the necessary care. Pancreatic cancer is a stealthy and dangerous disease, but by recognizing these warning signs, you may have a better chance at early detection. Remember, while these symptoms can also relate to other conditions like gallstones, liver disease, or pancreatitis, persistent or worsening symptoms should never be ignored. Reaching out to a healthcare provider is crucial, as early diagnosis can significantly improve treatment options and outcomes. Staying informed about your health can make all the difference. If this video helped you understand more about pancreatic cancer, please consider subscribing to stay updated on more life-saving health information. Your support could make a big difference, helping others stay proactive about their health too. Thank you for watching, and take good care of yourself and your loved ones.